Why don't we take a few moments and have you introduce yourself, say a few words, and tell us why you're running.
Okay, well, first, thanks for having me and thanks for organizing this. I know it was difficult given the amount of time that you guys had to organize. So I appreciate that you guys are doing it. So my name is Courtney Pyrke. I'm running as the NDP candidate in St. John Harbour. And I am a librarian. I'm a professional librarian. So I used to work at the St. John Free Public Library as a community services librarian. I mostly worked with teens when I was there. And before that, I worked at Dalhousie Medicine, New Brunswick as an academic medical librarian. So in that position, I worked with students and doctors and physicians and healthcare providers and all different kinds of people in the healthcare system and the school to support them with their research needs. And now I'm actually taking a hiatus from my field and I'm doing a full-time PhD at the University of New Brunswick, St. John campus, with Dr. Julia Woodhull-Melnick. And I'm looking at how high school students in New Brunswick are learning information literacy skills. So in terms of information literacy, that's kind of how you find information, evaluate information, critique information, like understand it, and then how you use it either in your research or like in your daily life. So it could be anything from like, if you're booking a hotel, knowing to look at the reviews of a hotel before you book it, that's information literacy. Or it can be if you're doing an academic article, knowing like where to get your resources from and where to find your evidence from, and being able to tell like, is this evidence biased? Like, is this paper funded by a big pharma company? How does that make the research bias? So stuff like that.
So we're contributing to campaign literacy right now.
Yeah, campaign literacy. Yep, that's yeah, it's super important, and it's particularly for helping people understand the like political jargon can be quite difficult to understand. So like when we talk about like tax reform, like what does that actually mean? Tax reform. When we say tax the rich, people might think, oh, they're going to tax my uncle in Quispamsis because he lives in Quispamsis, so he must be rich. Where tax the rich actually means taxing the people who the 1%, the billionaires and the millionaires who have money like sequestered away. But when people don't have information literacy skills, they don't understand like what that means.
What's a campaign day like for you in this unprecedented COVID environment?
So it's pretty hectic and it's different every single day. So I guess I'll like talk about what I did yesterday. Yesterday I started at the Wheelhouse, which is where my headquarters is. I get there and my campaign managers, Owen and Tina, kind of like go through my day with me. And then we kind of organize, okay, so I went to the Pulse Barbecue yesterday and we decided Tina's gonna come with me to that while Owen stays behind and like helps with like signs or something instead. After that, I went to the Romero House car wash that they had. And then after that, I come back and eat some food for a bit of, when I have like a bit of time in between doing things. And then I help with organizing things for the campaign, posting stuff on social media. It's really important that I'm like telling people where I'm at and what I'm doing and who I'm meeting with and who I'm talking to. I had some folks come down from Fredericton yesterday to help me with phone calling. So we're trying to access a system that will give us phone numbers and stuff for people that I can call to ask if they'll vote for me or if they'll put a sign in their yard for me or in their window.
You're adapting to COVID.
Pardon?
You're adapting to COVID as much as you can.
Yeah, and I always have a mask, so yeah, a mask. But mostly it's meeting people, meeting community organizations, meeting nonprofits, and then talking to like the online community about it. It's difficult with COVID because I'm not doing door knocking. I know that some people are doing that, but I'm not comfortable doing that. So it's harder to reach people who don't have a computer or who don't have internet. I can only really reach them through signs. And then I also don't have a campaign phone right now. I only have my personal phone, so I can't even really give out a phone number. I have an email, but then I get to go off a computer or internet. You can't email me. So it's definitely challenging, and I'm trying to get out into like community parks as much as I can so that people can meet me there instead of me going to their home or into their apartment or what have you. Yeah.
I'd like to talk a bit about voter turnout. It's fallen markedly over the years from a high of over 82% in 1967 to a little over 66% 2 years ago. And voter turnout in St. John is notoriously low, and of course in Harbour, it's the lowest of any of the 49 constituencies. Do you have an explanation for this, or what could we do to improve the turnout?
So it's a good question, and it's something I've been thinking about a lot lately, because when I had to actually go out and get nominators to be put on the ballot, so just people in the community can put their name on my paper, and when I have 24 or 25 names with their addresses, I can be put onto the ballot. So when I was doing that, as soon as I hit Union Street up towards Waterloo Village, every single person that I asked to nominate me didn't have an address and indicated that they experience homelessness. So therefore they can't nominate me because they need an address. You need an address to nominate a candidate. I originally thought that because they don't have an address, they can't vote, but I've since found out that they can vote, but you have to jump through another hoop to do that. So it's another barrier just to be able to vote. You can't just walk in and say, I experience homelessness, I want to vote. There's like more steps you have to do to be able to do that. I don't know them all in detail, but I was talking to a lawyer about it, and that's kind of what they told me. So I think that's an issue. One is that there's a lot of people who experience homelessness in this riding. There's a lot of people who experience poverty in the riding, and voting is not their main priority. Like finding food is their priority, finding employment is their priority, finding clothes for their children is their priority. Voting is not a priority for them, and like rightfully so when you've been kind of beaten down by the system year after year after year, and you're not getting the support that you need from the government, which is we're asking you to vote for the government when the government is not supporting you in the way that they could be. So I think that's definitely an issue. And as well as like even people who are middle class, like I've talked about this before online, like sometimes my parents don't vote. My parents are middle class, and when I ask them, why are you going to vote this year? They'll say, well, it doesn't matter who I vote for. They're all going to screw me in the end, is what they say. That's their words, not mine. And I think a lot of people feel that way, that the government's not there for them. So why should they be there for the government? So yeah, I think that's some of the, and there's other issues too. I know it's difficult to vote as well. So this year they're not going to have polling stations at the nursing homes. That's another barrier. They're not going to have polling stations at the university. That's another barrier. And on top of that, getting to the polling station, it's at 70 Crown Street. So you need to, if you're not mobile, you need to find someone to take you there. Transit's limited right now because of the pandemic. It's hard to get a ride right now because of the pandemic. So in the past, I know for Jennifer McKenzie's campaign, her and her volunteers would pick people up and take them to the polling stations to vote. But this year we're not doing that because of COVID. So there's another barrier there for people. So I think it's a pretty complicated question. There's like a lot of issues as to why people aren't voting. And I think we, as a government, I mean, I'm not part of the government, but as a government, they need to do a better job at getting these people what they need in order to vote.
We canvassed a number of community organizations working in the constituency. Here are a couple of questions based on the themes they raised with us. And the first one deals with poverty.
Yes.
Poverty rates have been persistently high in this constituency. Minimum wage rates are low and only tied to inflation. Social assistance rates are low. Millions of dollars has been spent by the province in St. John since the last election in 2015. What do we have to do to get the rate down?
So yeah, the $15 minimum wage, that's part of the NDP platform. They have put in the platform that they want to raise the minimum wage to $15 an hour within 4 years, and I think that that's not soon enough. So for me personally, I'd want to see that raised sooner than 4 years, and that's what I would fight for if I was to become elected. The other thing is tax reform. I talked about that a little bit earlier, is taxing the ultra wealthy. These people have more than enough money to go around, enough money that they would never be able to spend in the next like 100 years even. And we need to create a fair system where these people are paying their fair share in taxes, and then using that money to put towards social services such as transit, putting it towards the nonprofit sector, putting it towards community partners, community partners that aren't a nonprofit. So like Living SJ isn't technically a nonprofit, but they're a community partner. Putting it towards those things, I think, is what we need to do to support the community. Yeah.
COVID magnified a number of issues for vulnerable populations. Food insecurity, isolation, mental health issues often arises as concerns. Precariously employed constituents talk about the absence of paid sick leave as an issue. The opening of schools worries many parents. What's your plan or your party's plan to ensure that these issues highlighted by COVID are addressed?
Yeah, so in terms of COVID, I mean, my partner works or is in the healthcare sector, so it's something I'm always thinking about. And I think it's really important that we leverage the money from the Bank of Canada, because so the Bank of Canada is currently buying government debt with low interest rates. So we need to invest in that and then use that money to put towards the community, to help the economy and to help the people that are like the grocery workers and the underpaid nursing home workers and those people. In terms of education, something that Kate Grogan had actually talked about, and she's the candidate in Quispamsis for the NDP, is childcare. Childcare is super important. It's so expensive in New Brunswick to put your child in daycare, and I think that universal childcare needs to be looked at, needs to be implemented. Parents and caregivers, moms and dads and parents need to be able to go to work and not have to worry about how they're going to pay for their families while they're at work. That should be covered by the government. The thing that Caitlin had brought up was oftentimes when a parent has to stay home, it's often the mom who stays home. So, we need to support women who are going to work. And I think in order to do that, we need to support universal childcare. So that's something that both the NDP and myself really care about and really want to invest in and want to push and fight for, is that families shouldn't have to worry about how they're going to pay they shouldn't have to worry about who's going to take care of their kid and how they're going to pay for that when they have to go to work. Yeah.
Next question is about healthcare.
Okay.
New Brunswick has the second highest rate of disability in the country. And constituents have raised concerns about mental health, addictions, wait times, and access to a family physician. What would you do to improve our healthcare system generally and in the constituency in particular? Yeah,
so this is actually part of my platform, is access to healthcare. It's super important to me. I think we need to invest more in primary care. Primary care is a family doctor or a walk-in clinic, or kind of that first person that you see before you're pushed off to a specialist if you need to be seen by a specialist. We need to invest in primary care, community health centers, more family doctors, more nurse practitioners. I see a family doctor where there's also a bunch of nurse practitioners that work there, so it's great because if I don't necessarily have an issue where I need to see a family doctor, I can talk to a nurse practitioner instead and then not hold up that time from the family doctor for someone who needs to see the family doctor instead. So that could be anything from like renewing a prescription to just a consultation if they're not sure if I need to see the family doctor first. So that's been a great service because the wait times are lower. So for the doctor office that I go to, I can usually get an appointment within a month because there's a bunch of nurse practitioners that work there and I can see them instead of the family doctor if the family doctor is busy or booked. I think the other thing is universal pharmacare. So when I was on the Lower West Side at the kids' play park there, I met with a couple who had told me that they're both seniors, they're both retired, and each of them pay $100 a month for medication that they need to literally live. Like if they didn't have that medication, they would die. So they're using their pension to pay for that medication. One of them had mentioned that he was diagnosed with cancer and he needs to get a shot that costs like $2,000 every month. And he was borrowing money from his kids to pay for that. I think that's ridiculous. I don't think that people anywhere should be having to pay for medication that you need to survive, to live. So for universal pharmacare, for people who don't know what that is, it's a system where if a doctor prescribes you medication that you need, that's covered by the government. You don't have to pay anything for it. So I think that's super important as well, investing in that. For me personally, Clinic 554 is really important to me. I identify within the LGBTQ plus community. So those are services that I personally need, and I know that there are a lot of teens in the community that are also identify within the LGBTQ plus community, and they need that service too. So definitely funding Clinic 554 and expanding that service across New Brunswick is needed. Repealing 8420, that needs to go. It needs to be axed, it needs to be cut. And then also backing Bill 11. So Bill 11, the vaccination bill that Dominic Hardy had brought forward for the mandatory vaccinations for kids in the school system. So it wouldn't allow exemptions from that. For philosophical or religious reasons, you would still have to get the vaccination unless you're allergic to something in the vaccination or something else. I think those are all really important things, especially during COVID. When we get the vaccination, people need to get vaccinated in order to move past this pandemic.
In July, there were 89 people in St. John actively experiencing homelessness. Men, women, young and old. Concerns were raised about systems and discharge planning and how sometimes hospitals and jails, for instance, would discharge people almost literally into homelessness. What does the province need to do to end homelessness?
So that's a pretty loaded question. There's a lot of things that the province could do to end homelessness, but I think one of the most important things is affordable housing, affordable mixed income housing. I was talking to some people on the Lower West Side yesterday who had told me that they're going to have to move out of where they live on the Lower West Side, which is a priority neighborhood, because their rent increased and they can't afford the increase in their rent. And they don't know where they're going to go, because right now the Lower South End is like one of the cheapest places in the city to live. So I think that's super important, is affordable mixed income housing. I had mentioned earlier that I actually work with Dr. Julia Woodhull-Melnick. We're lucky in that we live in a city where there's a lot of academics and well-educated people that are at arm's length from us. So I think that we should be working with people like Dr. Julia Woodhull-Melnick and even Dr. Wiseman, who both specialize in homelessness and housing, for their support, especially in terms of how to address these policy issues that we're having. So like there's the double taxation, that's an issue that I hear a lot about that needs to go. I know that Eric focuses a lot on Dr. Wiseman, sorry, focuses a lot on tiny homes. So that's an interesting project that we should be investing in. For Julia, she focuses a lot on mental health and well-being for people who experience homelessness, and as well as affordable housing. So I think for the government, they need to be working with these experts on how can we address this, what can we do. Dr. Julie Woodhull-Melnick and Dr. Wiseman, they both moved here from Ontario and worked with experts in Ontario on this issue. Julia had worked with Dr. Jim Dunn, and he's very well known in the research of affordable housing. So I think we need to be relying on these resources and working with these people on kind of addressing this issue and moving past the homelessness. Something else that I really care about personally is education. That's what I'm studying in school, is education. And people who experience homelessness, they need to be educated. They need to get their GED, they need to get their high school diploma, or they need to get post-secondary, depending on if they want to do that or not. So I think there needs to be more funding put towards like the Learning Exchange and the Teen Resource Center, who are kind of doing the heavy lifting in terms of helping the community get their GED and their high school diploma and any post-secondary education for that. it's hard to get a job in the city if you don't have a high school diploma or a GED. So, yeah.
A quick question we're putting to all of the Harbour candidates. Do you support the proposal to build a new school in the South End?
Yeah, so it's the community hub and the learning commons. So it's more than a school, which is what I think is interesting, is that it's a school with like a community hub that has wraparound services, and that's so needed in the community, especially in terms of supporting young learners, people who are having a harder time learning to read or figuring out like learning to do math, like to have those wraparound services, especially for mental health and well-being, that's so important. And I'm 100%, as someone who studies education, I 100% see the value in that. Something I didn't talk about actually, which that reminded me because I had met with Develop St. John to talk about this project, was digital literacy skills is so important. So when I met with Develop St. John to talk about this project, the learning commons part of it, I know that there's going to be like a focus on technology, and that's so important as someone who worked in the public library. I know that skill set is definitely lacking in the community. We had a lot of people who would come in who wouldn't know how to get an email, how to go on Kijiji, how to fill out online paperwork, how to even like turn on a computer. There were people who didn't know how to turn on a computer, how to use a mouse, how to use a keyboard. Like it's a huge gap in the community that we need to address. So I think like that school is definitely going to help with addressing that issue, where a lot of these kids don't have computers at home, and a lot of these kids' parents don't know how to use a computer. So where are they learning that if there's no support in the community for it?
Any other issues you'd like to address? Any final comments?
I don't think so. I think that covered everything. I mean, I really care about the city. I care about uplifting the community. I'm tired of, I want to say, older white men, I guess, deciding my future. And that's a big reason why I want to run, is that being in the public library system, I've seen a lot of people come in whose values and voices aren't being heard. And I think that's something that I can work towards, is making sure that these people are being listened to and making sure that these concerns are being addressed. Yeah.
Courtney, thanks very much. They're
Thank
running
you.
in the St. John Harbour constituency in the upcoming provincial election. Thank you.
Thank you so much. Thanks for having me.